I am the co-chairperson of the second National Nursing Research Webinar. This event is organized by the Beta Nu Delta Nursing Society and Nursing for Humanity. Beta Nu Delta Nursing Society is a professional organization of Filipino nursing leaders and, of course, researchers. It is established in 1993, and the society's mission is to enrich the lives of both its collegiate and alumni members through lifetime opportunities for friendship, leadership, learning, caring, and sharing. On the other hand, the Nursing for Humanity is a company based in Sydney, Australia, with the theme Knowledge Development in Nursing for a Better Health, Better Philippines. This webinar envisions the latest health and the latest update for emerging topics in nursing and healthcare from our leading doctoral nursing researchers in the Philippines. I would like to inform you of our event partners, which are the Visayas State College of Nursing, which is under the leadership of Dean Joel Acob, the Philippine Nurses Association, Caraga Region, under the leadership of its regional governor, Mr. Jed Patrick Catalan, Dr. Rian Gadin from Saudi Arabia, and the Zarate Memorial Fund, which is through Emery Zarate Yuma. Please be noted that everyone, this is being recorded and may be broadcasted. And if you choose to participate in a discussion, you are presumed to consent to use of your comments and your image in these recordings. So today, I will be joined by Mr. Jesper Domsil Bayawa as my co-host and moderator for this event. Jesper is a licensed nurse, also a midwife, and a licensed professional teacher. He is currently working as a senior high school coordinator and designate school nurse at Rizal National High School in Santiago City, Isabela. Hello, Jesper. Good afternoon.
Hi, good afternoon, everyone. I'm glad that we are having this webinar. Okay, so we are having this event to share results from previous researcher to improve the care, services, and formulation of policies. So in the formulation of policies, so nagiging research based na siya. So without further much ado, let's start the ball rolling.
All right. Okay. So before we commence this webinar, I would like to invite the research program chairperson for this second National Nursing Research Webinar, the Dean of the Visayas State University College of Nursing, Dean Joel Ako.
Hello to our dear participants for this national activity of knowledge sharing. Allow me to convey my warmest salutations to all our partakers from the different colleges of nursing in the Philippines, Philippine Nurses Association, our counterparts from neighboring Asian countries like Indonesia, Malaysia, and among others. We also have participants from Saudi Arabia and Singapore. To the Beta Nu Delta Nursing Society, VSU College of Nursing, Nursing for Humanity, and PNA Caraga region, and of course to our resource persons for this event. Good afternoon to all.
Good afternoon.
2020 is named the International Year for Nurses and Midwives. However, it is not the year our nursing education leaders envisioned. Many of the plans have turned upside down and is still change and uncertainty ahead. The pandemic as a global phenomenon thrust our education and school communities into rapid transition to remote learning, which affected almost every facet of school-based education. Understanding the effect on our school students and teachers is crucial as we begin to reconfigure our ideas of what education may look like in the post-COVID-19 world. For all educators, the shift to remote teaching meant a rapid change to alternate models of teaching learning. With all these changes, nursing as a human-based response profession is called upon to address the appeal for a better Philippines. This can only be done if one engages actively in knowledge development through research. Research is crucial for the development of nursing discipline, and qualitative research at that produces a kind of knowledge that permits generalizations relating to the phenomenon under study. Nurses and healthcare increasingly are embracing and guided by achievements and challenges of evidence-based practice and reflective practice. Nursing science advances have positioned nurses to move forward in the development of science. New directions for interdisciplinary research, nursing knowledge, and the need to emerge in several ways, including in the development and emphasis on the nursing care process, creation of new workforce patterns, and development of economic theories of nursing practice as expressions of unending care. This afternoon's endeavor is dedicated to update our nurses and other stakeholders on the current updates of emerging topics in nursing and healthcare from our leading doctoral nursing researchers in the country. It is anticipated that this undertaking will shed light on the importance of engaging to scholastic process of knowledge generation being the heart and the soul of nursing apart from teaching. In today's activity and environment, hoarding knowledge ultimately erodes your power. If you know something very important, the way to get power is by actually sharing it. Thus, this webinar. Finally, my heartfelt felicitations to all. Thank you, and I'm hoping that you will be raising questions and comments after a series of presentations. Good afternoon.
Thank you, Dr. Acob. Thank you for inspiring us to continue conducting research. Before we continue, we would like to acknowledge the presence of our nursing leader in our country, most especially to Ma'am Cora Anunuevo and Sir Albiag. Okay, and also to all research enthusiasts, good afternoon. So this activity will help us improve our services that we are giving right now to our client. So to continue, let us move right now to our keynote speaker. Our keynote speaker is an emeritus professor of nursing within the College of Nursing and Health Sciences at Hawaii Pacific University. She is the editor-in-chief of Singapore-based Journal of Nursing, Healthcare and Global Science Technology Forum from 2013 to present. In 2016, she was nominated for Daisy Award for Nursing Faculty by the Hawaii Pacific University College of Health Society. In February 2018, she served as a keynote speaker at International Nursing Conference with the theme Transforming Healthcare, Exploring the Current Challenges and Possibility in Nursing Health in Hawaii. She served as an advisor of the Philippine Nurses Association of America and Hawaii chapter from 2014 to 2016. Our keynote speaker holds membership with the American Association of Critical Care Nurses, American Association of Nurse Practitioners, American Nurses Association, Hawaii Nurses Association, Beta Nu Delta Nursing Society, and the Sigma Theta Tau International Honor Society of Nursing. Let us now hear a keynote message from Dr. Nita Jane Carrington.
Hello there.
Yeah, sorry.
Good morning, good evening, wherever you are in this wide world of ours. My name is Dr. Nita Jane Carrington, and we're doing a webinar for the second National Nursing Research Webinar of the Beta Nu Delta Nursing Society, which envisions the latest updates of emerging topics in nursing and healthcare from our leading doctoral nursing researchers in the Philippines. So I am assuming that most of you, my audience today, are doctoral nursing researchers, while many of you may become educators for our next generation nursing graduates. So to fulfill the theme of this webinar, Knowledge Development in Nursing for a Better Health, Better Philippines, I chose the three following topics to present. Number one, concept-based teaching for students, conceptual learning. This is an emerging topic because I don't think many of our nursing schools are yet teaching this way. The second is leadership. This is really not an emerging topic, but nurses are now expected to perform many roles, and that nurse educators should be leaders, or all nurses should be leaders in our field. The third one is self-care. It's as old as life itself, but our society has many health problems because of the lack of self-care. So to start, concept-based teaching, which is my first topic. In concept-based teaching, students must learn how they know, not what they know. A step towards achieving this is to know what concept is. So what is concept? They are abstract ideas, general notions. Examples are values, beliefs, truths, thoughts, actually your name too. Things that are not visible, things that you cannot touch. There are four main topics in nursing that a nursing student needs to be familiar with before a student can begin to care for patients. The four concepts are the human being, which is the patient as a whole, the environment, health, and nursing. I don't think I need to elaborate on this, as I'm sure we are very familiar with how these concepts are applied. To accomplish conceptual teaching for our students, we need to teach concept mapping. Concept maps are visual representations of information. They can take the form of charts, tables, and flowcharts. These are especially useful for students who are visual learners. Concept mapping is an instructional strategy that requires learners to identify graphically to link key concepts by organizing and analyzing information. And these are samples here. These are good examples of how concept maps are organized. This third one did not come out very well, but you can see that it has a nice flow to show mapping concepts. The second one actually is what I usually use in classroom and clinical. So now that we have looked at concept maps, how do we deliver concept-based teaching? I have identified four pillars of clinical practice, because this is where our nursing students end up after nursing school. The first one is evidence-based practice. Evidence-based is the professional inquiry and research of best practices. I would like to emphasize that, best practices that have been tested and validated. We usually require our students to do research in the early years of nursing school. The second one is critical thinking. How do we teach critical thinking? We guide our students in the process of actively evaluating information, actively. What are this information? They are research data that have been tested and proven. I want to emphasize that again. Research data that have been tested and proven. For example, why do we bathe our patients? Why do we get them out of bed early after surgery? Oh, I'm sure you know the answers to these, because these are simple nursing interventions, but their efficacy and positive effects towards faster recovery of patients have been proven to be evidence-based. So we guide our students in analyzing and applying this information. We actively involve our students throughout their nursing school. I attended a webinar on innovating an ancient technique to teach thinking. It was about engaging our students in storytelling, and actively participating in discussions, both in classroom and clinical, using real case studies. The third is clinical judgment. Clinical judgment requires practice in realistic learning environments. Thus, our clinical rotations, so students observe and practice with real patients. This may be somewhat hampered now because of the coronavirus pandemic. Simulation in the lab is next best, but the experience is not optimal, in my opinion. Clinical judgment is making decisions based on critical reasoning, learned information, and lived experiences, again attained during clinical rotations and taking care of real patients. Clinical judgment requires the formation of habits. I want to emphasize that again, formation of habits during experiential clinical rotations. So other authors stop at clinical judgment, that's the third one. But I have added a fourth pillar that is most important to me, and that is clinical competence. And I even put it in red because it is the doing part of critical thinking and decision making, because it measures the delivery of patient care, and it is also the observed outcome of critical thinking, decision making, and clinical judgment. It's the ultimate yardstick. If patient care has been effective, did the patient get well? Because safety in patient care is bottom line. So please give your students the tools they need to build habits of evidence-based practice, critical thinking, clinical judgment, and clinical competence in their future practice as professional nursing. My second topic is leadership. According to John Boggs, effective leaders aren't born. They grow by choosing to think and act a certain way. Leadership is power to influence others, I hope in a positive way. Leadership is inspiring everyone around you to live a better life. Just being yourself, true self, or your authentic self. I submit that all nurses are leaders because great nurse leaders inspire and guide great nursing practice. During the current coronavirus pandemic, nurses juggle many roles within the healthcare system. They are on the front lines caring for ill patients. Nurses balance to meet the demands of patients of doing the job well, but which requires knowledge, physical skills, the cognitive ability to manage time, and also educate the patient. And best of all, it is the caring attitude that is the hallmark of nursing care. Other demands of nurse leaders in a growing and rapidly changing profession are educators, mentors, preceptors, advocates, researchers, financial consultants, data analysts, case managers, and through other formal or informal roles. The American Nurses Association has declared that all nurses are leaders because all nurses are expected to demonstrate leadership and must challenge themselves and the profession to develop effective leadership. So I have adapted Dr. Kimberly Gibbons' 5 leadership styles in nursing. The first one is transformational, democratic, autocratic, laissez-faire, and servant. I'm going to describe these, but as I go over these leadership styles, perhaps some of you will identify which style you most identify with. So transformational leadership. It is collaborative, encouraging, and inspiring a shared vision to facilitate change. A transformational leader encourages innovation and is tolerant of error. In healthcare, transformational leaders are most successful in situations where the system is in need of larger changes or overall improvements. For example, a policy change on how often should a critical care patient be wakened up during the sleeping hours. Some patients experience neurosis if unable to get adequate sleep while in the intensive care unit. The second is democratic leadership. A democratic leader engages in shared participation of members of the group to guide decision-making and management. Sometimes this is called participative leadership. Democratic leaders are often characterized as mutually respectful, collaborative, empowering, and supportive, but when a system or process improvement is imperative, may step into a group assigned to identify changes to a policy or protocol. Autocratic leadership is the third. Autocratic leadership is a unilateral style in which the leader delegates to others with rules and orders. These leaders are intolerant of innovation and error and are the opposite of laissez-faire leaders. An autocratic leader or autocratic leaders are generally characterized as self-reliant, highly structured, rapid decision makers, authoritative, and ultimately the boss. This leadership style may be useful in healthcare during emergency situations, traumas, or disaster management when clear, definitive, rapid decisions and directions benefit all involved. So as a critical care nurse for 50 plus years, both at the bedside and teaching senior graduating students, and have been in administrative positions, I have experienced this leadership style, which is called for often. The fourth one is laissez-faire leadership. A laissez-faire leadership style is a facilitated one in which a leader makes few decisions, often identified with a hands-off approach. Facilitates the group to develop solutions, which is this laissez-faire is an opposite of autocratic leadership. The fifth one and last one is servant leadership. Finally, servant leadership is defined as a supportive style in which the leader provides team members with skills, tools, and relationships they need to perform to the best of their ability. Servant leaders are often noted to share power, listen actively, conceptualize problems, empathize with others, and prioritize others over themselves, which is not really a bad style of leadership. So I have occupied leadership positions throughout my professional years, and to be honest, I have exercised all 5 of these leadership styles. You may have also. So my third topic is self-care. In my Master of Science in Nursing program, I was exposed to all nursing theorists, and each of us graduate students had to write our thesis from the theorist we identified with. From how I was raised by my parents to when I raised my own children, my own personal practice of health, and my practice as a nurse practitioner, I identified the most with Dorothea Orem on her theory of self-care. I'm going to give you a couple of seconds here to look over the nursing theorists and see whether you would identify with one of them. So to move on, my viewpoint on 3 aspects of nursing and health education are, the first one is incorporate self-care. I really like that in all undergraduate nursing and health sciences courses. The second one is self-care education for patients as a professional commitment in all of nursing practice. I like that too, because all nurses should be committed professionally for self-care. The third one is nurses and health educators as vehicles in educating and empowering society in self-care. Nurses should really be vehicles. In other words, we can educate and empower our society, our people, so that they can care for themselves. So, I would like to challenge you this question. Should the framework of self-care be a major movement in nursing education? My view of the human being is his or her capacity to think, choose, and self-actualize. My philosophy of life is in relation to one's responsibility for health. And really, I'd like to emphasize one's responsibility. So with these values, you know what, I think I missed a slide here, so I'd like to go back there. It is the nursing education as vehicle to educate and empower others in self-care. Because self-care is key to our health and well-being, our family, our relationships, and the state of affairs, and the state of our society. I believe that nurses are professionally charged as educators for health. What better place to start than our nursing and health sciences program? What better place to be recognized as leader, my previous topic, in the movement for a healthier society? Because bottom line, safe patient care starts with self-care. Okay, back to my challenge question. Should framework of self-care be a major movement in nursing education? Again, I'm going to repeat myself, sorry about that. My view of the human being is his or her capacity to think, choose, and self-actualize. And my philosophy of life is in relation to one's responsibility for health. And I really would like to emphasize one's responsibility for health. So with these values and beliefs, I will close my presentation. So as your keynote speaker for this webinar, I hope I was able to contribute to the knowledge development in nursing for a better health, better Philippines, specifically in the Philippines. So thank you for giving me the opportunity to share my passion for nursing education in the Philippines for better health through self-care.
So thank you for the
For
opportunity.
the opportunity. Sorry, my PowerPoint seems to be a little lagging. But anyway, thank you again for giving me the opportunity as your keynote speaker to share my passion for nursing education, leadership, and the principles of health through self-care. And I hope that I was able to contribute to the knowledge development in nursing for a better health, better Philippines, specifically in the Philippines.
So thank you for the opportunity
So
to
thank you for the opportunity to
speak today. Thank you,
today. Thank you, Dr.
thank you
Gatti.
for emphasizing to
Thank you for emphasizing to us and
challenging
about
self-care
self-care,
as the idea on
as the idea on
leadership and self-care.
leadership and self-care.
Evidence-based research is
Evidence-based
useful to
research is
develop the
useful to
concept-based
develop the
teaching,
concept-based teaching,
leadership skills, and our
leadership skills, and our self-care.
Thank you, Dr. Carrington and Jesper. So, since this session is being recorded, for those nurses who are unable to participate today, at the end of the presentation, we will answer your questions, which you can type in at the Q&A box, and that you can see at the right side of the panel. And we will address as many questions as we have. So reserve your questions, write them down, and or you may put them later on the chat box. Certificate of participations will be emailed to you alongside with the link of the recording of the webinar.
So the mechanics
So the
of our
mechanics
webinar
of our webinar
are as our
are as
presenter,
our presenter,
10 minutes video
10 minutes
presentation,
video presentation,
which were made
which were
available
made available
on
on
the
the
7th
week
to
of
13th
7 to
September
13 September
2020,
2020.
following each
Following
recorded
its
presentation.
recorded presentation,
Esteemed audience
team
members were
audience member
invited
were
to send
invited to
in their
send in their
questions by
questions
commenting
by
under
commenting
their
under
respective
their
video.
respective video.
The
The
presenter will then
presenter will then
respond to the main
respond to the
question
main question
raised by the
raised
audience
by
in
the
a
audience in a
panel discussion
today,
today,
Friday,
25th
25th
September
of
of
September
2020.
2020.
Before we move
Before
on
we
with
move on
our
with our
presentation,
presentation,
let me
let me
inform the group
inform the
that
group that
if you have a
if you
question,
have
you
a
can
question, you
log
can log
into
into
Mentimeter with
Mentimeter
an IP
with an
number of
IP number of
72
72 84 65.
65. So you can
So
type
you
in
can
your
type
question
in
in
your question in
Mentimeter. Let's proceed right now to
Let's
our
proceed right now to our first.
Dr. Sandy Yao,
Dr.
Jr.,
Danielle Jr.,
registered nurse and has
registered
obtained
nurse and has
in
obtained
health
a
professional
diploma in
education,
health professional education,
master in medical surgical
master in
nursing,
medical surgical nursing,
doctor of healthcare
doctor
management,
of healthcare management,
science and gerontology,
science and
nursing.
gerontology, nursing.
Research interests includes
Research interests includes
health professional
health
education,
professional education,
gerontology nursing, and
gerontology nursing, and research.
Dr. Yao is currently a
Dr. Yao is
faculty
currently
member
a
at
faculty
Cebu
member
Normal
at
University.
Cebu Normal
Let
University.
us now listen
Let
to
us
the
now listen to the
Dr. Sandy
presentation
Yao
of Dr. Danny
to
Yao
study
to
age
study
expectation,
age
elderly
expectation,
versus
elderly
youthful
versus
seniors.
youthful seniors.
Good day, everyone. Let me introduce myself. I am Johnny J. Yao Jr. from Cebu Normal University. and I am here to talk about my research about aging expectations. Specifically, the title of my research is Aging Expectations, Elderly versus Youthful Seniors. And just like the different colors illustrated in this slide, we will explore the complex and unique issues surrounding this phenomenon. Let me start with this famous quote by the boxing legend Muhammad Ali. And he says, "Age is whatever you think it is. You are as old as you think you are." So, what are the thoughts and questions that come to your mind after listening and reading the quote? The quote suggests that how we age is influenced by our perspectives towards aging and being old. So, does this mean if we have optimistic views of aging, this will automatically translate to successful aging? And would the opposite be true as well? If you think being old entails deterioration and disease, it will come true. But what shapes these aging expectations? How do these beliefs influence the lives of older adults? And how do people with positive and negative aging expectations differ? These are some of the questions that prompted me to conduct this research. Now, when we talk about aging, there are common characteristics that we need to consider. First, it is a highly personalized process. This is because people will have different and unique life experiences. There may be some similarities, but taken as a whole, it will be unique for each person. Next is that aging is also a complex process, and just like any other human experience, it involves different dimensions and in various contexts. So, for example, we do not only look into the physical aspects of aging, but we also look into other dimensions such as psychological or social. And lastly, just like other social processes, it is accompanied by numerous stereotypes across cultures. This includes my setting, the Filipino culture. Now, the problem with stereotypes is that when we follow them, people then disregard the differences between individuals, which leads to believing things about people that might not be true. And the bigger problem of aging stereotypes is that it is mainly negative. They portray growing old as a period of poor physical and mental functioning. Older adults are dependent, they have poor health, and they are lonely. It may be true to some, but definitely not true to all. These stereotypes are based on a person's aging expectations, which is usually categorized into negative and positive expectations, meaning if a person thinks that aging is associated with problems, such as illnesses, then it is categorized as negative. On the other hand, if a person does not associate aging with problems, or if the person thinks that they can still be happy in old age, then it is categorized as positive. Studies have shown that expectations of aging will subsequently influence the person's health and wellness. It is a very complex phenomenon that has significant implications on older people's health and wellness. So, the purpose of this study explored the various sources by which Filipino older adults attribute and reshape aging expectations. So how did I do my study? I used a multiple case study design to explore the various sources of aging expectations and to compare the cases of older adults who have negative and positive aging expectations. Participants were community-dwelling older adults aged 60 years old during the time of interview, and are currently residing in a highly urbanized city in the Philippines. I transcribe all the interviews and analyze the data using a cross-case analysis, meaning I analyze each case and later on analyze across different cases. This method enabled me to compare the commonalities and differences in the processes, activities, and events regarding aging expectations. How did I get the needed data for this research? After getting technical and ethical approval, I started to recruit participants for the study, and to fit the cases needed for the study, I use a standardized questionnaire, the expectations regarding aging, which measures their level of aging expectations. This would represent older adults who have negative or positive aging expectations. And out of 95 participants, a total of 8 informants, garnering the 4 highest and the 4 lowest scores on the standardized questionnaires, were interviewed. Based on the analysis of the data, 3 major themes with corresponding sub-themes were generated. These describe the sources which shape and reshape the older adults' aging expectations, as well as comparisons of older adults having positive and negative aging expectations. For the first theme, attributions of aging expectations, the informant's perception of what it is to be old and what they expect when one becomes old are attributed to various sources. So we will talk about the 3 attributions. First is your personal attributions. The informant's expectations of aging here are based on their younger selves relative to their status now as being a senior citizen. All of them acknowledge that there are changes compared to when they were younger, and this does not only include physical changes but other changes like their capabilities. The next subtheme is your interpersonal attributions. Their expectations are also influenced by how other people view them as being older persons. Since all the informants interviewed were married and had children, the responses of their family members, especially their children, were main factors that have reshaped their expectations of aging. Some of their children would tell them to be more careful because they're now senior citizens. The last subtheme is your socio-cultural attributions. The different views, values, and systems in their community and society concerning older adults provide another source of how aging expectations are shaped. The informants' aging expectations are based on what they believe society views what it is like to be old. These stereotypes are either confirmed or disconfirmed as they experience the status of being senior citizens themselves. So these are the common sources that shape and reshape aging expectations. The second theme, divergence and harmony in perspective, talks about the various perspectives between older adults who have positive and negative aging expectations. After analyzing the data, it appeared that those who had negative aging expectations considered themselves old due to their physical limitations. On the other hand, those informants who had positive aging expectations did not consider themselves as old, but did acknowledge their status of being a senior citizens because of their age. But they did not say that they were young, since the informants knew that they were already senior citizens. But there was an apparent preference to distance themselves from those who were considered by society's definition as old. Hence, there are 2 groups of seniors that emerge based on the analysis: the elderly seniors and the youthful seniors. There are certain similarities and differences between these 2 groups. All of the informants acknowledge that in old age, there are certainly physical changes when one becomes older. Those informants who have negative aging expectations already felt that they are old because they have chronic medical conditions, physical limitations, and changes in their physical appearance. They consider these changes as a normal part of being old. On the other hand, those informants who have positive aging expectations acknowledge that there are physical changes due to old age, but the major difference is that they do not consider that old age will lead to drastic limitations. They do have chronic illnesses, they do have physical declines, but they believe that it should not limit their activities. All of the informants felt that if they were considered as senior citizens, there were no major changes on how they think and the quality of the social relationships with other people, including their family and relatives. In that aspect, in their psychosocial expectations, they are similar. The last theme, Living and Aging, Life as a Senior Citizen, talks about the differences in the lifestyles of the two cases. All of the informants claim that there are certain adjustments in their lifestyle due to changes that they have experienced as older adults. These lifestyles are also influenced by their aging expectations. They say that being active in old age is important in order to find purpose and meaning, even with the physical changes and transitions in life. The main difference is that those who have negative aging expectations have highlighted the changes in the lifestyle due to their physical limitations and presence of medical conditions. These, in turn, would confirm these negative aging expectations. Furthermore, they would express concerns in managing these changes. On the other hand, those who have positive aging expectations acknowledge that they have illnesses and limitations, but everyone does not express worry about these. Instead, they emphasize how they are still able to manage even with these physical changes. They also believe that old age should not drastically limit their activities. These positive aging expectations may have influenced their current lifestyle as a senior citizen. Finally, based on the findings, I have derived this figure. The findings suggest that these aging expectations are attributed and reshaped by personal, interpersonal, and sociocultural sources. The findings also suggest that a person's aging expectations also influence their lifestyles when they are already older adults. There are studies which suggest that people who hold negative aging expectations underestimate their capacity to participate in physical activities, and as a consequence, they exhibit a more inactive lifestyle. On the other hand, having positive aging expectations are associated with better health outcomes. Also, several longitudinal studies propose that development of negative aging expectations are influenced by current health and changes in health. So when individuals experience health problems, the blame is on the problems due to aging rather than the lifestyles. Consequently, this will reinforce existing negative aging expectations and promote the development of more negative aging expectations. In this manner, a brutal cycle of worsening condition in old age would happen. In this study, the two cases mainly differed on how they were able to handle the changes due to their aging expectations. Those who had positive expectations were able to adapt amidst these changes compared to those who had negative expectations. Let us discuss some of the implications to practice and research. Based on the findings, it is recommended that non-government organizations or local government units promote activities that aim to educate the senior citizens about the differences with normal and abnormal changes in old age. Also, society, most especially the family members of the senior citizens, should be educated about the expected changes and common misconceptions in old age. With this, people will be more sensitive in approaching senior citizens. Family members should consider a balance between being protective but still maintaining independence as not to unduly limit the older adults' activities. Senior citizens should also maintain a positive outlook in life amidst the changes that they are experiencing. It is important for them to be aware of these changes so that they will be able to customize their activities according to their capabilities. Furthermore, it is important for senior citizens to engage in activities that are enjoyable and even try out new things so that they can still find meaning and purpose even in old age. Lastly, future researchers may explore the lived experiences of older adults who are institutionalized or those who have terminal illnesses or conditions. This could shed light to the aging expectations of older adults who may have unique experiences. Let me end this presentation by providing a synthesis in the form of a quote by Mark Twain, who says that age is an issue of mind over matter. If you don't mind, it doesn't matter. Finally, if you want to know more about this research, you may read the full article published in the qualitative report by following the link via the URL or the QR code. Thank you very much for listening and have a great day.
Thank you, Dr.
Thank you,
Yao,
Dr. Yao,
for your
for your
presentation.
presentation.
Thank you for
Thank you for
helping us to
helping
develop
us to develop
positive
a
attitude
positive
towards.
attitude towards.
If you do have questions to Dr. Yao, you may reserve them, or later on we shall use the application Mentimeter. In the meantime, I would be presenting our next presenter, which is Dr. Bonibilia Amora. She is currently working at the University of Bohol College of Nursing as a clinical instructor, academic coordinator, and professor in graduate study. A recipient of scholarship in master's degree and doctorate degree by the University of Bohol and the Commission on Higher Education, an advocate of gerontology care, and mother of two bright children. Let us now listen to the presentation of Dr. Bonnie Belia Amora in her study Psychological Function, Productivity, and Social Function Towards Self-Worth.
Morning to each and everyone. I am Miss Bonibelia Hamora and I'll be presenting to you my research study entitled Psychological Function, Productivity and Social Function Towards Self-Worth. Aging is part of human life, and as human beings age, they often feel incapable of doing things and even feel unwanted and uncared for, affecting their self-worth. Self-worth refers to how a person views himself amidst all the trials and troubles that he meets in his life. It inculcates the person's sense of purpose and confidence. However, it is important to note that one's sense of self-worth fluctuates as the person experiences success or failures in life. Data from the United Nations revealed an increasing number of persons aging 60 years old and above, from an estimated 962 million people in 2017 to 2.1 billion in 2050, which could rise up to 3.1 billion in the year 2100. Growing old is not easy, especially when physical deterioration sets in. According to one of the biological theories of aging, these physiological changes occur due to the wear and tear of the body cells and tissues that affect the body's function. As the old person's physical vitality decreases, he becomes less productive in his life and often withdraws himself from the society, affecting his relationship with others, as explained in the disengagement theory, affecting his self-worth. As the person's age increases, he may lose some of his important roles in life, which in most cases affects how the person sees himself. However, according to the continuity theory, engagement in worthwhile activities and connecting with people in the society can help maintain the old person's sense of worth. This change in the world's demographic profile has a strong impact on the Sustainable Development Goal of the United Nations, especially on the aspect of promoting healthy lives and well-being for all ages. Because as the person grows old, his health, outcome, needs, and even value can change. This goal of the United Nations is supported by RA 9974 of the Philippine Constitution, known as the Expanded Senior Citizens Act of 2010, which provides full support for the total well-being of the elderly and their full participation in the society. This study is anchored on the self-worth theory of older adults, which promulgates that the perceived self-worth is a positive function of the psychological, social function, and extent of productivity despite declined function in old age. The psychological function refers to the respondent's quality of life, life satisfaction, and spirituality, while social function relates to the emotional support provided to the respondents as well as the level of processing provided by loved ones, while the extent of productivity refers to the respondent's engagement in worthwhile activities. The person's past experiences in life, as well as the decrease in his physical vitality, may have a negative effect on the old person's life, but it will have a reduced intensity as he tries to reach out and connect with friends and relatives, and as he tries to engage in some worthwhile activities, making his life useful. The study aims to validate the assumption of the self-worth theory of older adults, which states that the perceived self-worth is a function of a positive psychological, social, and the extent of productivity despite declined function in old age. The hypotheses of the study are as follows. There is no significant degree of relationship between the self-worth of the respondents to the psychological function, which includes life satisfaction, quality of life, and spirituality. Second, there is no significant degree of relationship between the self-worth of the respondents to their social function, which includes the respondent's social support and level of presencing. Third, there is no significant degree of relationship between the self-worth of the respondents to their extent of productivity. This study utilizes the descriptive quantitative research design method utilizing random sampling techniques, where 115 respondents took part in the study. All of the respondents are 65 years old and above with good cognitive function. For the results and discussion, one cannot deny the fact that a lot of stressful life events occur as the person grows old, which have a different impact on different people and are associated with a decrement in the quality of life of the older adults. Findings of the study revealed that the respondents have high quality of life despite all the troubles that comes along their journey. In psychology, quality of life has been defined as a conscious cognitive judgment of satisfaction with one's life. This definition coincides with the findings of the study, which revealed that the respondents are also very satisfied with their life. Older adults are described as the most spiritual and religious of all age groups in the United States and even in other countries, and this was supported by the findings of the study, where respondents were found to have a high spirituality. Studies have shown that prayer and engagement in religious activities enhance life satisfaction, reduce emotional distress, and helps in addressing the health crisis of the elderly. Studies revealed that the support provided by family members and friends are important for the psychological well-being of older adults. However, as depicted in the screen, respondents only received moderate support and felt the partial presence of their family members, relatives, and friends. The respondents have observed that their loved ones who provided them support are physically present and are attending to some task on their behalf, but it is the most superficial level. This is attributed to the fact that most of the family members who provided support have also other concerns, such as those related to their own job or those related to the problems that they have with their respective families. Older adults are often seen to be physically fragile, with declining health function, affecting their productivity. Being productive does not only refer to the amount of money that older adults earn, but has something to do with their ability to be engaged in positive and worthwhile activities even with the presence of illness. Results of the study revealed that respondents have low levels of productivity. They were found to be highly involved in physical activities than leisurely and intellectual activities. Majority of the respondents are highly engaged in doing light household chores and in attending organizational or group meetings. The result coincides with the findings of the study of Sofaer et al. In 2005, showing the desire of the elderly to remain independent in their life and their desire to socialize with friends from around their community. Their engagement in an organization is helpful in boosting their self-esteem as they experience the feelings of belongingness and the chance to interact socially with friends. Respondents of the study have high self-worth, which contradicts to some studies in the past that have pointed out the declining self-worth of human beings as they advance in age. This finding could be attributed to the things that the older adults have done in the past as they conquer the challenges in their lives, making them more stronger emotionally and psychologically. Such would lead the person to appreciate the goodness of life and the confidence that whatever life brings, he can always do anything right. The study identified three subvariables that comprise the psychological function of the respondents, and this includes the respondents' quality of life, the satisfaction, and spirituality. On the other hand, social function is composed of the social support and presencing. Data analysis using person R revealed that the old person's quality of life, life satisfaction, spirituality, and productivity are significantly correlated to the self-worth of older adults, thus rejecting the hypothesis. Moreover, the social support and presencing are insignificantly correlated to self-worth, thereby accepting the hypothesis. Among the independent independent variables, spirituality and quality of life emerge as predictors of self-worth. The findings suggest that being involved in spiritually enhancing activities contributes to self-worth. Moreover, the quality of life of the person determines the self-worth. This means that the higher the quality of life, the higher is the self-worth. On the whole, life satisfaction, spirituality, productivity, and quality of life contributes to 28.2% of the variance of self-worth. This finding illustrates that close to one-third of self-worth is caused by these four variables. The following conclusions were crafted based from the findings of the study. First, the respondent's psychological function is influenced by how he sees his life as a whole amidst all the trials and challenges that he encounters in his life's journey. Second, support from family and friends are important to reduce the effect of life's painful experiences, but it is not strong enough to affect the self-worth of older adults. Third, aging process affects the productivity of the elderly, but they still shows the desire to be useful to the community and to be socially connected to their friends within the society. Fourth, the development of self-worth among older adults is affected by the person's psychological function as depicted in one's spirituality, quality of life, and his extent of productivity. Fifth, the self-worth theory of older adults therefore is a function of a positive psychological, personal function and extent of productivity as it is dependent on one's own response to life's challenges in old age. Sixth, the study generated evidence that spirituality and quality of life are the emerging predictors of self-worth. The recommendations are as follows. First, short activities to be conducted at the barangay level and to be spearheaded by the barangay officials and healthcare workers. Second, short lectures involving the significant others of the elderly could be instituted emphasizing the importance of the involvement of the older adults in worthwhile activities to the development of their self-worth. Third, activities and workshops that would enhance the provision of emotional and informational support as well as the provision of affectionate support from family members, relatives, and friends are hereby recommended to increase the level of social support given to the elderly. That's all, and these are some of my references. Thank you very much.
Thank you, Dr. Hamora, for your concise and very good presentation on psychological function, productivity, and social function towards self-worth. Jesper, are you there?
Yes, finally,
Yes,
our
finally, our
Dr. Migno del
Dr.
Morales.
Migno del Morales.
He is a quality
He is a
improvement
quality improvement
which focuses on
which
providing
focuses on providing
care in the healthcare
in the
organization.
healthcare organization.
Abandoning mixed method research,
Abandoning mixed method research,
particularly in the
particularly in the
methodology,
methodology,
interpretation,
interpretation,
analysis.
analysis.
His passion to
His
serve the
passion to
community
serve the community
made him as a
made
prime
him
mover
as a prime
of
mover
mental health
mental health,
between youth leaders
youth
and
leaders, and
profession. Let us listen to
let
Dr.
us listen to
Del
Dr.
Morales with his
Morales
study
with his
entitled
study entitled
The Perception of
The
Nurse
Perception of
Manager
Nurse
on
Manager
Patient
on the
Safety,
Patient Safety Culture,
Safety Culture
Safety
Maturity
Culture Maturity
of Selected
of
International
selected internationally
in Metro
in
Manila.
Metro Manila.
Good day, this is Nino de Morales from Trinity University of Asia. sharing with you my dissertation, The Perception of the Nurse Managers on the Patient Safety Culture and the Safety Culture Maturity Level of selected internationally accredited hospitals in Metro Manila, Philippines. In healthcare, there's a 1 in 300 chance of patients being harmed during confinement. Industries with higher risks, such as aviation and nuclear industries, have a much better safety record than healthcare. A well-grounded culture on patient safety affects clinical outcomes, safety of healthcare providers, the financial capacity of the organization, and the satisfaction of patients and also the employees. Based on the researcher observation, one adverse event, such as fall with injury, could cause financial burden for the organization, increasing the length of stay due to another clinical problem such as broken bone, which may lead to another possible nosocomial infection. The researcher seeks to explore the relationship of patient safety culture maturity level among tertiary international accredited organizations towards creation of a model. What are gaps? Limited researches regarding patient safety culture and safety culture maturity level, lack of patient safety culture models in the context of the Philippine practices, superficial analysis of patient safety culture in terms of their components. Patient safety culture model from Agency for Healthcare Decision Quality had been adopted by the researcher. Safety culture is composed of management support, effective communication, commitment to organization learning, transparent reporting, and teamwork. It is affected by different factors such as human factors, management systems, communication systems, and others. The researcher also used the safety maturity model of Edward Fleming, which has 5 levels: emerging, managing, involving, cooperating, and continually improving, which is, if there's increasing level, it is improving safety culture, and there's consistency. Methodology. The researcher used mixed methodology, triangulation, concurrent parallel method. It is quantitative and qualitative approach. Our setting is international accredited institution, tertiary level hospital, 200 to 300 bed capacity. My respondents, or the researcher respondents, are nurse managers, regardless of units and departments. My sampling method is purposive convenient sampling. Responsive rate is 93%. My study variables is demographic profile, including age, sex, educational attainment, and length of service. It will be correlated to the patient safety culture and the safety culture maturity. Data collection and analysis. The phase 1 is qualitative phase, which in we will use the adapted questionnaire from Agency for Healthcare Research and Quality, the self-made questionnaire based on Fleming's model, with Cronbach alpha 0.86. The phase 2 is the quantitative phase, wherein there's open-ended question in the survey. And the last phase is analysis. For quantitative analysis is statistical analysis, and for qualitative analysis is thematic analysis. My results and findings. For the demographic profile based on the respondents, there is 51% under 30 years old. It's more the millennial type. The sex or gender is 70% female. Education attainment is 84.3% is Bachelor of Nursing degree. And our length of service is 46% composed of 6 to 10 years length of service. Based on the safety practices mean scores, as you observe, the lowest 3 is hand-off and transition, communication, openness, and staffing. Based on the safety culture maturity level, you can observe that the highest is in the managing level. The relationship of safety practices to the demographic profile, as you observe, based on age, there is relationship between the age, the sex, and the educational attainment and length of service based on the teamwork across the units, communication of openness, and staffing. So as you can see, because of the age group of less than 30 years old, they are millennial type, that they have that openness of communication. They're very empowered to verbalize their concerns, and teamwork across the units. They have this feeling of cohesiveness to others. And with the sex, gender, it is more on because of there's differences in dealing with a female staff and the male staff. In educational attainment, as you can see, there's rejection of the null hypothesis. There's a relationship between teamwork across the units and staffing related to educational attainment, because based on the Republic Act 9173, our nurse managers should have at least master's level. And length of service, because of their experience within the organization, they have the tendency to adapt in this limited staffing, and they can relate to a more experienced staff in other units. Relationship safety culture maturity level to the demographic profile. As you observe, there's relationship between the age and the length of service, because as we age, we have this increasing number of our experiences, which lead to a much more mature in decision making and analysis of situation. Based on the correlation analysis of significant relationship between safety practices and safety culture maturity level, 0.040, low positive correlation, and with no significant correlation. Based on the qualitative analysis, safety practices, based on the thematic analysis, it's effective communication with protocol and policy adherence, managing safe environment, leadership involvement, diminishing workforce, and precedence of care. For safety culture maturity, the themes emerge are development opportunities, collaborative endeavor, and sustainable change. And for relationship of safety practices and safety culture maturity, standards, initiated action, holistic and motivating culture, coherence and compliance, organizational transparency, and care for the environment. Demographic profile of the respondent affects the patient safety culture. As you can see, based on our results, the age, the sex, the length of service, and the educational attainment has directly affect our patient safety culture. In terms of age, there's multi-generational workforce, which means that there are ones that they can have the initiative. Some of the staff should have a policy to guide them for the procedures. And for gender, nurses, our majority is in a female part. However, there's an increasing number now of male nurses. So there's differences between managing the expectation not only by their staff but also their patients. And regarding their educational attainment, the majority of our nurse managers is bachelor's degree holder that needs to have and should be addressed by the human resource management for them to be equipped formally with additional tools for them to decide well and plan well within their units. And last is length of service. The length of service determines how they manage their unit. The higher the length of service, the more experienced they are and the more cases they've been through. So through experience, they've learned and they decide based on their learnings. Leadership have a pivotal role in promoting culture of safety because based on our results, the highest mean score for patient safety practices is management of patient safety. Management is the foundation of changing culture. Leaders should be a role model in changing behavior. The identified components for improvements were staffing, communication openness, and hand-off and transition. Staffing, communication openness, and hand-off and transition is also the lowest three components of Agency for Healthcare Decision Quality 2018. This problem is not only present in the Philippines, but it's also present in the world. Staffing problem is due to the declining of nurse enrollees, the K-12 scheme of Department of Education, and other nurses go abroad for greener pasture. For communication openness, based on the culture of the Philippines, we are hierarchical in nature. It is more on we follow, we obey the rules based on the hierarchy of the healthcare organization. Here in the Philippines, we have that highest respect to our physician. And there is a gap and barrier to that practice, that the nurses are having that difficulty to be empowered to voice out their concerns. And hand-off and transition, it can be multi-variable and multifactorial causes because hand-off and transition is very complex, even though we have that standards, but it is also bounded in the communication process of your units. Safety culture maturity level based on the respondents was on the managing level, which defined as following process and procedures in place. This maturity level was correlated to the demographic profile of the respondents. In a qualitative analysis, it was correlated to the results of the findings, which were the leadership roles, the importance of processes, the manpower struggles, and the safety encompassing environment and staff safety. This research was limited to the nursing service perception. The respondents were managers on the tertiary hospitals. To conclude, patient safety culture is affected by the structure of the organization, which includes human capital. There should be credible and competent employees. It was also affected by the leadership of the organization. The changes of culture should be emanated on the top. The leaders should be visible, active, and participate in patient safety initiatives. Human resource management and communication were the identified factors affecting the safety culture. Thus, based on the findings, the researchers recommends to have a continuous improvement in the process of recruitment until succession planning of staff to prevent manpower issues. Communication will be improved through policy review and creation of innovative solutions, such as collaborative notes and multidisciplinary rounds. Safety culture maturity is based on the continuous improvement of the organization. The accreditation is not a gauge of maturity of healthcare organization. It is founded through the efforts of the healthcare organization in achieving their mission together with inclusivity and growth of, and development. In sustaining high reliable care, the researcher recommends to utilize the proposed model created from these findings. Morales model sustained safety practices for reliable care. It is composed of three components: the core, the mantle, and the crust. The core is our goal: sustained reliable care. It means it is your end goal that all of our patient, our staff is safe and we're giving a reliable care and there's no changes, but it is continuously improving through time. The mantle is composed of the safety practices that had been identified in the findings, such as communication openness, feedback, teamwork across the units, staffing, organizational learning, handoff and transition, non-punitive approach, and management support for patient safety. And the last is the crust. The crust is how these safety practices will be sustained. It will sustain if the leadership supports the patient safety initiative and the safety practices imposed. Next, it should have a proper communication processes across the organization. Then it should have procedures and processes in place. And in the structure, there should be proper human allocation and human resource management. And there's this continuous cycle of improvement. Quality is everyone's responsibility by Edward Deming.
you,
You,
Dr.
Doctor,
At this point,
now
now
type your
type your
question
question
using your
using your
with the
with
code
the code
8870465.
887465.
Thank you, Dr. Yao, Dr. Hamora, and Dr. Morales for such insightful and engaging presentation. I can see a few questions coming from our chat box. We further encourage you
Encourage
to please
to
type your
please type
question
your
in
question.
the chat box. We do have few questions that we want to use to help start the conversation. Sir Fritz,
All right, for a while, I'm fixing our Menti. Okay. So you can type in your questions in the chat box as well as we can utilize the menti.com. If you're familiar with this, you may go to www.menti.com and you will be asked to enter a code. However, the code have changed now. It is not already 7284. It is 8870405 as mentioned by Sir Jesper. Okay, so we'll wait for your questions. And while we're waiting for your questions, we have here some insights from a nurse as well, which is Mr. Andrew Pepito of Cebu Doctors University about the presentations. So, all right, Sir Jerome is sharing the Menti. So while you are inputting your questions, Mr. Pepito's insight to Dr. Yao's study is that the study highlighted healthy aging, which is the process of developing and maintaining the functional ability that enables well-being in older age. It is very relevant in today's situation because of the increasing number of older adults in the population. Aging is a very subjective experience, and people have different experiences of aging, compared, of course, with other people. This perception of aging is very important, especially in their perceptions, including on health, as these perceptions may influence their behaviors towards health maintenance. Mr. Pepito also included that it is important to highlight that the growing old does not mean one is heading towards an unexciting part of living, but rather a phase of life filled with new experiences and opportunities.
Thank you. Thank you, Andrew, for pointing out some highlights of the study of Dr. Yao. This time I will be reading the reaction of Mr. Andrew Pepito on Dr. Hamora's study. This study is very relevant in the present times because population around the world are graying and also the high occurrence of depression and isolation among elderly. I believe that this study can greatly contribute to the creation of projects and activities for the elderly that can dramatically increase their self-worth, which can lead them to achieve self-actualization. When people in their late adulthood reflect on their lives, they should be proud of their accomplishment and feel a sense of satisfaction. They should be able to look back on their lives with few regrets. This study also highlights the importance of active aging, which is the continued intellectual engagement and social interaction along with all overall healthy lifestyle. Active aging optimizes opportunities for health, participation, and security in order to enhance quality of life as people age.
That was a good note from Mr. Pepito. No, I would like to read some of the chat from our or messages from our chat box. They are congratulating all of the presenters for doing well in their presentation. Meanwhile, I would like to read the insight again of Mr. Andrew Pepito from Cebu Doctors University on Mr. or Dr. Morales. Dr. Morales' presentation. He mentioned here, Miggy, a key objective of any healthcare system is patient safety, and administrators and leaders should have more interest in patient safety culture in their institutions. According to World Health Organization, patient death occurring due to preventable medical accident while receiving healthcare is estimated to be 1 in 300. We do not really know the true extent of patient death due to preventable medical accidents here in the Philippines, and that is the problem. He pinpointed that the problem specifically is the lacking of data. Although patient safety culture is important, what I regard to be more of importance is transparency. We should be able to have a look at the numbers so that we can know where to focus our efforts. Healthcare institutions should be more transparent so that they can show the public that they are willing to improve and are improving. Maybe Mr. Pipito highlighted here that we should be having more solid data in terms of what is really happening to our patients, be it good result or bad results. Since as we identify problems with patient safety, therein we can manage our problems. So,
So
do we
at
have
point,
questions? Yes, sir, Jesper. Go ahead.
so at this point, may we call on our presenter, Dr. Morales, Dr. Hamora, and Dr. Yao to to please open your camera for the question and answer. So let's start with question from for Dr. Yao. We know that aging is fast becoming a global issue. Please explain positive aspect of aging society by taking the Philippines as an example. Okay, I believe this question is for Dr. Yao. So we know, let me repeat it again. We know that aging is fast becoming a global issue. Please explain positive aspect of aging society by taking the Philippines as an example.
Okay, good good afternoon, everyone.
Good afternoon, sir.
Um, Although, with regards to the question, as mentioned in my study, there historically, um, a- aging stereotypes have been present in almost all cultures, especially even in the Philippines. But what is important to note now is that because of increasing awareness and education, not only to healthcare providers but also in the community, that there's already awareness that it doesn't mean that you are growing old, that it's full of horrors, negative aspects. No? So you can actually grow old gracefully. You can have successful aging. So even in the Philippines, it's being addressed those negative stereotypes because as mentioned in my study and in previous studies that these beliefs of aging will ultimately affect health outcomes. It will affect our lifestyles. So, if ever we think that hypertension would be part of growing old, then we no longer exercise or we no longer eat a healthy diet. So, actually, that in a way, that's the main positive development in terms of aging that I could relate to my study. That there's already increasing awareness of positive aging. Active aging is already being considered by people. But again, we need to increase awareness, as I have mentioned, because not all people, not all people in the community, older adults in the community, would have that perspective. Okay, so I guess that's it. Thank you.
Okay, thank you, sir. So another question for Dr. Hamora and Dr. Yao. May I ask if you were also able to find out in your study that need satisfaction as one get age also shape and influence aging expectation and towards achieving a positive aging expectation? So this question is addressed to Dr. Yao and Dr. Hamora. May I ask if you were able to find out in your study the need satisfaction as one get age also shape and influence aging expectation and towards achieving a positive aging expectation?
Okay, so let me address that first. With regards to my study, it's not really part. It was not that variable need satisfaction was not really specifically part of the study, but we could extrapolate that in previous studies and even this my study, if you are satisfied with your own aging and if ever there are needs that are there is positive satisfaction towards your aging, then it's also associated with positive outcomes and also positive behaviors. Although I have to say it's not directly part of my study, but there
Yes,
are previous studies that would verify that claim. Thank you.
Dr. Hamora. Dr. Hamora.
Hello, everyone. I'm sorry. Good
Yes.
afternoon again. Good afternoon. So, with regards to
Afternoon
the need
po.
satisfaction, actually, in my study, I have included life satisfaction with regards to the development of self worth among the elderly. And it was found out that there is a correlation between life satisfaction and the development of self worth in the elderly, which also would promote wellness and well-being from among the older adults. Thank you.
Okay, thank you. Sir Pritz.
Yes, Sir Jesper. We have here another insight from JC. He is a nurse based in Cebu. He inputted his concern or insight, his reflection on YouTube. I'll just
Mhm.
read it. Allow me to read. This is JC's insight onto Dr. Johnny Yao's presentation. Uh, it reads, the researcher presents his study in a systematic and understandable manner, which is also reflects on how the research was conducted. The study, Aging Expectations, Elderly versus Youthful Seniors, helps us realize the complexities of aging, including the changes involved and how the family and the community's view of aging expectation. He also included that the findings promote awareness among stakeholders on how they can be sensitive in our approach to our senior citizens. In addition, this is naman JC again from Cebu. JC's insight on for a while. Sorry. On Dr. Hamora's presentation. So he mentioned that the study is relevant to the global reality that our population is aging. So the findings of the study attributing spirituality and quality of life as predictors of self-worth will help the government and other stakeholders develop evidence-based interventions, while the other or older population has low extent of productivity. They are still highly engaged in household activities and, of course, involved in organizational ventures. So that's it for the two presentation with regards to self-worth and uh, aging.
So
So,
let's
Doctor, yes,
move to
sir.
next question.
Go
This
ahead.
is addressed to Dr. Morales. What would be the state of science in examining the impact of nurse staffing in hospital and other healthcare organization on patient care quality as well as safety focus outcome? So this question is addressed to Dr. Morales. What would be the state of science in explaining the impact of nurse staffing in hospital and other healthcare organization on patients' care quality as well as safety focus outcome?
So thank you very much for that question. So the staffing per se is one of the component of patient safety culture, and I agree. There are researches, there are studies that if there's decrease in staffing ratio, or there's overwhelming staffing, or there's no staffing at all, it increases the mortality rate of your institution. Thus, we can say that there is directly correlation if the staff is not satisfied or there's lack of staffing correlate to a um, unsafe practices in organization. Okay, thank you.
Thank you, sir.
Can I add on the for Mr. Or Dr. Morales, JC from Cebu again, he had his insight with Dr. Morales's presentation. It says that the study provides timely data to the extent of patient culture or patient safety culture, including the safety culture maturity level based on nurses managers perception. So he mentioned that patient safety has been emphasized by regulating authorities, by requiring appointment of patient safety officers, and of course requiring healthcare institutions to some relevant policies. However, development of a patient safety culture needs an overhaul of the processes and systems of healthcare institutions. He added that the study revealed that nurse managers' perception on staffing, communication, including handoff, were the lowest compared to the management support, non-punitive response, and including feedback. Although there was no significant relationship between safety culture vis-a-vis with patient safety culture during quantitative data analysis, the qualitative thematic analysis pointed out five themes: the standard initiated action, holistic maturity, coherence on compliance, organizational transparency, and of course, care for the environment. He added lastly that healthcare institutions need to invest in its manpower, not only to improve competencies related to patient safety, but also ensure adequate nurse-patient ratio. Moreover, it is recommended that a similar study involving entry-level nurses and also hospitals, which are not internationally accredited, to get the reality on the ground. So I beg to agree with, of course, Mr. Divina, no? Since patient safety is not a choice for us, healthcare workers, especially nurses. It is a must for us to deliver. Yes, Jasper.
Okay, thank you, sir. Let's move to another question for Dr. Hamora. How might self-work affect resilience to health adversity in older adult? So this question is addressed to Dr. Hamora. How might self-work affect resilience to health-related adversity in older adult?
Good afternoon once again. Well, if an older adult is having a high self-worth, he would be able to have a positive outlook in life, and he would be able to become more engaged in more productive activities, and whatever um, circumstances that we may experience during his life in these golden years, he will be able to adapt to it, especially with his outlook in life and with his spiritual foundation that really affects the development of his self-worth.
Okay, thank you, ma'am. Can I ask my personal question to Dr. Yao? Okay. So I take note some of the key points of the study of Dr. Yao, and right now, may I know, Dr. Yao, what are your recommendations or suggestions right now to nursing leaders? Especially, we have a lot of nursing leader present here in our webinar to improve to improve, okay, aging expectation among elder. What
Yes,
are specific programs, activities that you can suggest so that we can improve here aging expectation?
yes. Thank you, sir. Basically, it's simple. Based on my study, we need to first educate them with the differences between normal aging and pathologic aging. So whether it's in the community, even our students should be educated. So it has started, especially with the incorporation of gerontology as important courses in undergraduate studies and also in graduate studies. There are also already majors in gerontology nursing. So also in the community, we do not only educate the older adults or the senior citizens, but we also need to include the family members because of course we need to look into the client in its context because it's very important that some of the older adults may be dependent on their family caregiver, so educating them will ultimately help the older adults as well. So basically at first we educate them about the normal aging process and the pathologic aging so that they'll be aware, if ever this is normal, this is not normal anymore, so that they can cater their activities to the condition or to the status of the older adults. Thank you.
Thank you, sir. So another question for both Dr. Yao and Dr. Hamora. What is the future of gerontology nursing practice in Philippines? Any insight? So this question is addressed to Dr. Yao and Dr. Hamora. What is the future of gerontology nursing practice in our country?
Okay. I think it would be for me. When I think about it personally, gerontology now in the Philippines is not as advanced as a specialty compared to other countries. No, but we are going there, as mentioned, as I've mentioned before, incorporating it in nursing education, not only in undergraduate education, but also in graduate studies, will ultimately advance this specialty. And later on, we with the nursing law, the new nursing law, of course, there will be certifications for specialty. No, so everyone, I personally I am looking forward to that, so that we can advance the field of gerontology, because of course everyone will grow old, no? So all nurses, everyone will be able to experience growing old. So of course we need to be able to know how to manage conditions, how to take care of people, no? Because, and also in gerontology, it's not just old people, it's aging itself. No, we can address that even if you're young, no? So the aging process is something that we also need to consider. Okay, thank you.
Thank you. Yes, Dr. Hamora.
I go with Dr. Yao's opinion. Actually, in our present situation, right now in the Philippines, we are not in that situation with other country. But it could be because of the culture that we are practicing right now, that we often have this strong family bond, that our elderly or our older adults are being taken care of by family members, their children, or their relatives maybe. But it is, as Dr. Yao says, it is very important for us to know how to take care of these older adults, because most of the time the family members are just like they are taking good care of our older adults, but it is not in a scientific way that could sometimes hurt the feelings of our older adults and sometimes affect their self-worth.
Thank you, Dr. Hamora and Dr. Yao. Last question to Dr. Mignodel Morales. It's about patient safety culture and safety culture maturity. Uh, this is my personal question, sir. Uh,
Yes.
um, Now, because we are now in the pandemic, okay,
Yes. Yes.
and safety is one a reason behind why nurses are being infected with the virus COVID-19. Do you think, sir, there is really a need to revise policies and guidelines, or there is a need for us to have here a law that will tell us, okay, or is there a need for us to incorporate in our nursing law and emphasize the importance of having safety culture and safety culture maturity?
Okay. Thank you, Sir Jasper.
Yes,
So
sir.
first, I want all of you to understand that we have the UP Manila College of Medicine, Pharmacy, and Nursing has this collaborative research. It cuts across the 42 hospitals and three JCA hospitals in the Philippines. So we are coming up with these standards indicators that will be a foundation or even a guidelines for across all, even its private or tertiary hospitals. Then I agree with you if there's a standard or if there's a law regarding this, but please let's go back in my model. The model is it is founded within the leadership. As you can see in the crust, it should be founded in the leadership. Thus, if the leaders know the the status of his or her staff, he or she should do something with it. It regardless with law or even the patient safety. Now, is the staff safety is more prioritized than the patient safety, because safer safer healthcare workers equates safe patients. So, as you can see, we should not wait for a law to be passed, but it should be within the institution. There should be a movement from the leadership, and it will go across the policy, then the compliance, and the satisfaction will also increase. So for me, it is the culture per organization. So it should not be in a law. It should be within your institution. Thank you.
Thank you, sir. Sir Prince?
Yeah,
May
maybe
I ask?
I asked Dean Joel.
Okay, I am very intrigued with the study of safety culture with Dr. Morales. And yeah, it's true that we need to have or to observe this safety culture. But my thing is, I think this is not a question, but I would like to solicit idea from Dr. Morales.
Yes.
When we say safety culture, example, during disaster or to disaster stricken place where our authorities, our local leaders will ask or will uh, inform our dwellers to please evacuate or move to a higher ground because this is not a safe place. However, these people who live and who associates to that environment for so long are hesitant to move because they themselves know that even if this is a disaster-stricken place, but they know their degree of culture. I mean their degree of safety. I mean, I would like to ask if who determines that safety culture, or should we say that local leaders are not seeing what these people are able to see on the ground because they are not leaving this place because even if this is a disaster, as I've said, disaster prone area, but they hesitate not to live because they know their culture, their safety culture at that. So, any comment,
Okay.
Dr. Morales?
Yes. Thank you, Dean Acob. So, based on my research, it is a in the context of a culture. It's a culture of the organization. I agree with you. This research is for institutional. So I want also to explore. I agree with you. I want to explore the culture of a community. So it's different because is the my model, Morales model of sustained reliable care could be adopted or could not be adopted because again it is in the healthcare or in the hospital it's more structured and we have this hierarchy of communication of command or chain of command, not like in a community. So I agree with you. However, this study of mine is more on the institutional level. But I agree with you. I want to have also to check the mixed methodology in a community level. So that's very good. We can use also the AHRQ patient safety culture on the community level. So we will remove some unnecessary components because such as communication or handover. So it's more on in the clinical side. So, but I want to reiterate that it should be founded in the leadership. As you can see, there is BDRRMC because the LGU gave the power to the local leaders, even the mayors or the government. Thus, the mayor and the other LGUs should act on what should be decided. And after the leadership, there should be laws or policies or guidelines that should be decided. So that should be clear before we say that, oh, the culture of this community is different from this community. We should first be clear on the policies implemented on a specific area. And may I ask also, if it's in the community level, may I ask what is the priority of your LGU? That's very important in seeing in the perspective of the culture of your community or a barangay. Thank you, Dean. Is it okay, Dean? Or are there clarification?
Thank
Thank
you,
you, Dean.
sir. Sir Fritz?
Yes, thank you, Sir Jesper. Thank you, Dr. Morales, and of course, Dean Acob. No? What I get from Dr. Morales is that safety culture and safety maturity should be institutionalized and rather individualized, and especially depending onto the needs of community, be it or in a healthcare institution. There is just one short question, maybe answerable by yes or no here. Does the model of Dr. Morales, was it tested and validated daw, according to Dr. Vibar?
So this is based on the quantitative and the qualitative approach that I've used in the methodology. And it's my recommendation for you to validate it, and we can validate it for another research. So, but based on my findings and the thematic analysis, it is we can generalize it in a specific area, internationally accredited hospitals in NCR. So you can also use this for checking or validating it to another sample or population. Thank you, Doc.
All right. There is another concern from Win-Win. I think this is a friend from abroad, Indonesia, I think. Correct me if I'm wrong.
Yes, from
What is
Indonesia.
your suggestion for applying the theory and can insert in my material when I teach our student? Maybe the question is incorporating it at the BSN program.
Is it for me, Doc? Sir.
Yes, for Dr. Morales.
Yes, for you,
So,
sir.
yeah, the model can be used based on the context that there's a premise there that it is used only or it is the product of this sample or population. We can use it in that specific sample. However, we cannot generalize it. We cannot generalize this claim because it should be tested to another population. Okay. And this model is based on the AHRQ model of patient safety and also the safety culture maturity of Lemming. Thank you.
Thank you, Dr. Morales. And lastly, here, is there a significant difference between safety culture in hospital and community? And I believe this was already answered earlier, no, wherein we reiterated that patient safety culture and patient safety maturity should be individualized and institutionalized. So thank you again to our amazing presenters, Dr. Morales, Dr. Yao, and Dr. Hamora, especially of course for adding value and of course strengthening the practice of nursing both as a science and as an art.
Finally, Dr. Faye Felicilda Rivera will deliver the closing remark. Dr. Rivera is an adjunct faculty of American University in Surrey, State Surrey. She is an member of the Beta Nu a nursing society and the Sigma Delta International Society.
Hi everyone, this is Dr. Faye Felicilda Reynaldo. I am very grateful to present the closing remarks for the second National Nursing Research webinar. I have enjoyed viewing and reading everyone's presentations during this webinar conference. I have learned a lot regarding ongoing research studies of our nurse researcher colleagues. I laud our colleagues on their continued curiosity, inquisitiveness, and creativity in researching and developing knowledge, even amid uncertainty brought about by the pandemic. The research our colleagues have presented shows that we are persistent and persevering in pursuing answers regarding our thirst for knowledge despite hard times. We are genuine innovators. I noticed that the majority of the questions we like to answer for our research focus on the who, what, when, where, and why questions. We like to explore, describe, explain, etc. We are less involved in interventional studies that delve into the how of things, and those studies that look into improving processes for our population's health. When I say we, yes, that also includes me. Our choice in research focus is quite understandable. After all, interventional studies such as randomized controlled trials or quasi-experimental studies are more expensive to conduct. They require the development of stricter protocols. they use more personal, and they take up more time. Furthermore, funding is hard to come by these days when we are competing with big names in the research industry. May I ask you, though, that you consider conducting pragmatic trials or quality improvement projects in your facilities? According to Merriam-Webster Dictionary, sensibly and realistically in a way that is based on practical rather than theoretical considerations. Many nursing scholars worldwide these days are conducting replication studies of evidence-based interventions in their facilities on a smaller scale to see whether applying these interventions are feasible. They conduct these small-scale projects to see whether interventions can be incorporated in their current care protocols and will improve the care of their patients, improve patient outcomes, or their processes in the healthcare system. Because they conduct these evidence-based projects in a practical manner, sometimes real life gets in the way. Staff who are often used to their care processes may not always follow the study's intervention protocol. Nevertheless, with continued encouragement and supervision from the researchers, protocol adherence can be as high as 70%. I work with several DNP students in their quality improvement projects or pragmatic intervention studies to improve patient care processes within their facilities. I present to you two project outcomes. One student provided an educational intervention to nurse practitioners and staff nurses at retail clinics about the evidence of the need for antibiotic stewardship when caring for patients with upper respiratory infections. In this project, the student provided the NPs and staff nurses with tools to encourage patient education on antibiotic stewardship. However, the student did not dictate how the NPs or staff nurses will educate their patients. When comparing the previous year and current year rates of antibiotic prescribing, the student found a 52% decrease in the antibiotic prescribing rate for upper respiratory infection diagnoses. In another project, my student conducted an educational intervention among 40 cancer patients about the evidence on how to counteract fatigue by doing exercise. In her presentation, she shared about the different exercises that could be done by cancer patients to assist with reducing fatigue levels. She provided the tools, such as pedometers, to keep track of their activity level. She encouraged them to increase their activity level in the next 8 weeks and to record their daily steps. Then they were to report their weekly fatigue levels and quality of life. After 8 weeks, she was only able to follow up with 5 patients. But these 5 patients showed an increase in their daily steps and reported reduced fatigue levels and increased quality of life. In this pragmatic trial, the attrition rate was a problem, but her pragmatic intervention helped 5 students improve their health outcomes. Pragmatic intervention studies or quality improvement projects for evidence-based practice are not perfect. There are multiple barriers that scholars and researchers will encounter. Attrition rates are sometimes high. Also, I know my students are having difficulty disseminating their results through publication. Conferences, however, are more welcoming regarding the dissemination of results of evidence-based practice projects. While I supervise these students with these types of projects, I find them very anxious. I always tell them that the type of intervention they are introducing in their facilities are ones that have already been supported as effective by multiple randomized control trials, systematic reviews, and or meta-analysis. We are now testing whether the intervention implemented within the facility is sustainable in a real-world setting. So if we can help even one person using EBP, then we have done a lot. I urge Filipino nurse researchers to implement pragmatic intervention studies backed by evidence in their facilities to better the Filipino people's health. Thanks so much for the opportunity to present during the webinar conference. If you have any questions, do not hesitate to contact me. I am happy to hear from you.
Thank you for the closing remarks, Dr. Faye. We learned also from her that evidence-based practice is really a must for us, not only in the clinical area, but also in the community. So I would like to remind everybody that placed in the chat box is our evaluation form. Make sure to fill it out to get your certificate. At this juncture, I would like to thank also our event partners. Again, they are the Visayas State University College of Nursing, the Philippine Nurses Association Caraga Region, Dr. Rick and Gadin from Saudi Arabia, and the Zarate Memorial Fund. So thank you guys, everyone, for attending the webinar. Uh, may we request you to stay for a while for a photo opportunity. So I'll stop sharing so that we may see everyone. Yeah. Sir Jerome, are you here? All right. Ikaw na sir mag-take ng photo? All right. Thank you. Everyone, you may open your camera. Make sure that your face is not covered or can be seen properly. We understand the background. Of course, we enjoy the safety of our home and our offices. Yung iba nasa work pa yata. Thank you for coming. Sir Jerome, game na tayo.
Yes, sir. No worries, no worries.
Thank you. Count ka lang, sir.
Okay, 1, 2,
Thank you.
3. Okay. All good. Next group.
Next panel.
Next panel.
All right. Hold your smile, everybody.
1, 2, 3. Good.
All right. Another.
Next panel. 1, 2, 3. Good,
Yeah.
good. Yep.
We have a lot of participants, so maybe just hold your smile.
250 participants. All right. Okay, next panel. Good. All right. Next panel, please.
Photo, the photo.
Photo, please.
Yeah, photo.
Okay. Next panel,
Right.
please.
Next.
Good photo, Ria.
Yeah, next panel, please.
And the last panel.
Last panel is all good now. Thank you very much.
All right. Thank you again, everyone, for coming. I know you have learned a lot. You may start filling out the evaluation form. You may find it on the chat box. Salamat.
Salamat po.
Thank you so much.
Congratulations
Congratulations.
to the presenters.
Terima kasih.
Terima
for
kasih
our
banyak.
Terima
Indonesian
kasih.
friends.
Terima kasih, Indonesia.
Terima kasih.
Terima kasih.
Terima kasih.
Thank you for our friends all over the world.
Ya, terima kasih semuanya.
Terima kasih.
Terima kasih.
Thank you po. Salamat po.
Thank you very much.